Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 cun posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other do points, so don't be tempted to go further back than 1 cun posterior to that midpoint. Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 cun proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief.
Sanjiao 10 is located 1 cun superior to the tip of the olecranon process of the elbow. The point is found with the arm flexed and the hand supinated. So moving from large intestine 2 to large intestine 3, over the head of the second metacarpal joint into a significant depression. Again, the hand should be loosely flexed, so in a loose fist, and you should fall into that point.
Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the first metatarsal. Feel along the inferior border of the first metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 cun proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4. Gallbladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap.